program. So diabetes is such an important topic for all of us, I believe, and many of us have know somebody or ourselves have one of the many types of diabetes. And we really hope that today, in some way, we can encourage all of you to share the knowledge that you may receive today and support each other and find and choose our own ways where we can live in balance of our medicine wheels and have this opportunity to focus on our well-being. Before we begin, I just want to quickly touch on two housekeeping items. For those of you who are new to our Indigenous Women's Health Talks, we always ask you to fill out a survey. If you can take that time, we really appreciate all the feedback that we get from everybody over the last few years. And we use all that information that you forward to us, and we take that info and we use it for future programming and creating events around those health topics that you are requesting and asking for. Those surveys are completely anonymous unless you would be like to have your name put into a draw for one of our monthly draw gifts. And in that moment, you would just have to give us your email. So for anybody who's within Ontario, who's joining us from Ontario and fills out one of those surveys, we can put your name in for the draw and mail you out that gift. This survey will be up for the next 5 days. So even if you're viewing this live stream at a later time, please still consider going into that survey. The link will be posted up very shortly. And just to it should take about a minute. And we really appreciate and want to thank you for anybody who does decide to provide us with that info. The second part of the housekeeping items we just wanted to share with you is that we are really, really interested in hearing any questions, any comments that you have today while you're listening to our live stream health talk. So if you can, within that chat box, send out your questions to us. We have a few people behind the scenes working with us, and we will make sure that your questions we'll forward them over to Kendra and she can answer them. Okay. Now, one more thing before I begin. I'm so sorry. I just wanted to let everybody know that I went and put down tobacco for this event just so that we can and all start this event off in a good way. So Marcy, Miigwech, and Yahweh to all of you who are joining us. I also wanted to welcome Kendra Recollet today, who is going to be leading us and this knowledge sharing for our Indigenous Women's Health Talk today on health, healing, and art. Kendra is a registered nurse. She's a certified diabetes educator and a diabetes wellness nurse with Nujmuin Tag Health Center in the Manitoulin Island area. Thank you so much for joining us today, Kendra.
I lost the, oh, there I am.
So you should be,
Hey.
Hello? You there?
I'm here. Can you hear me?
We can hear you.
We can hear you.
Ready to go?
Okay, great. Ani everyone. Kendra Recollet Dishnakas, Chiging Debenda Gwas, Adik Dodem. So I am from Manitoulin Island. My First Nation that I'm registered to is Chiging, and I am Caribou Clan. So I guess I will start with a little bit of a introduction to myself before I get the PowerPoint up. I've been a registered nurse since 2012, and I was born and raised on Manitoulin, and I love it here. So I wanted to come back here and work. I did a little bit of community health nursing in Wakwamikong for about 3 years, and then I moved over Tenochtitlan, and I got my certified diabetes educator, um, I guess like credentials. You have to write another exam to do it. Um, and I've also got my certification in cognitive behavior therapy. I've taken both the more Western approached course, and then I also did an Indigenous based one through Laurier that was really great if anyone's interested in taking it. Um, 3 years ago, I went back to school to complete my master's in nursing so that I could be a nurse practitioner. So I'm just finishing that up this year. I have one class this fall that I'm doing, and then one more in the winter, and then I'll be done. I'm trying to think of other things that I want to tell you professionally. I do like doing a lot of advocating for um, remote rural communities, for our First Nations um, people on Manitoulin Island, and just Indigenous uh, clients across Canada, really. Uh, the Diabetes Canada Association, who I guess publishes the clinical practice guidelines, has a professional conference every November. And last year, myself and my coworker Sarah were asked to be the co-chairs of the Indigenous Science Stream. So we do a lot of the coordinating and advocating for that stream of the conference. If anyone's interested, it's at the end of November in Toronto. And if you're First Nations or working in First Nations communities, there is a code, a promo code, so that your registration will be free. Um, I can give it to ONWA afterwards so that they can share it with everybody in case anyone is interested. Um, I'm also a co-chair with Health Canada. There, I always forget what QSAC stands for. Quality standards. What is the other? Sorry, advisory council. So that's a shared role, and we've been working for some time on an Indigenous cultural safety um, standard that they'd like to put out, but it does still have some work to do. So it's behind the scenes with um, other committee members and the other two co-chairs. I like doing group programming. I am in the clinic. Like I said, I am a CDE, so I do see clients one-on-one, or with the dietitian I work with, Sarah, and we do everything from medication adjustments. We order blood work. We um, make recommendations for possible better medication um, for managing, depending on what the person's uh, what other comorbidities they have. So if they have high blood pressure, high cholesterol, things like that. Um, I really enjoy making resources that are very picture based and very bigger picture so that you can see the actual interactions of each of the systems, because many of us grew up with very silo based teaching, and you took one medication for one diagnosis, and one thing caused this and one thing could fix this. So having those bigger picture ways to look at our health is one of the things I like to do, because of course we see things very relationally and specific to the person's context. So I don't like to explain things independent of context, which I will try to bring forth today as we get into our into the presentation. Um, I did make some notes so I wouldn't forget, because I tend to ramble and then I forget where I'm going. Uh, Personally, I am married. I have 3 boys. I have 2 German shepherds, a cat, and 2 horses. Um, we don't live in town. We kind of live out in the outskirts, kind of in the bush, and we do a lot of outdoors things, hunting, fishing. I grew up playing hockey. We do a lot of golf. I've recently taken up playing Fortnite so that I can play with my kids. Um, and I like to speak to chronic health and stress because, like most of us, have experienced it firsthand. And family members and friends, my kids. Personally, I have ADHD and anxiety, and I'm pretty open in sharing things that have possibly worked or things that I've tried, um, and really being open and transparent about that. So people don't need to feel like they're doing this alone, that even though I'm keeping my head above water, I also struggle just like everybody else. And some of what I'm going to present today is things that I've learned along the way through my nursing, some through my clients, professionally, as I've kind of shared their journey with them, and some things that I've learned along the way that help. Um, I am very fluent in sarcasm, so if that comes across, um, that is my love language. So I hope it works well with our group. And I'm currently hyperfixating on bullet journaling because it does help to ground me and kind of calm the chaos with having kids and work and school and so many aspects of life to try to keep in line, which I am actually doing quite poorly at right now. But I will get I'll share my screen so that we can see what's happening. I'm pretty informal when I'm presenting, so if anyone has any comments or they'd like to say anything, you can take yourself off mute and just kind of interrupt me. I do not get offended whatsoever. Cut me off, just start talking and I'll stop talking. Or you can write in the chat if you're shy. At the end, I also wrote my email, so if anyone has any questions that they want to chat about kind of more privately, but we can all kind of learn from each other and move forward. So try not to be shy. Um, oh, I am not even remotely close to being at the beginning. Okay. Can we see my presentation? Anyone?
Hi, Kendra. Yeah, we can see your presentation up.
Okay, great. And we're good so far for questions or comments?
Yes, we haven't had any questions come in yet. We'll let you know.
Okay, great. So again, I said I'm from ONWA Tech. There is me in the clinic on that little map because I know this is Ontario Native Women's Association. We will hopefully have people from all over the place watching this at some point. And in the blue, you can see our little island. In case you didn't know where Manitoulin was. So why is today's talk important? One of the things I noticed throughout my years working in community, so Nojmo Tech services Manitoulin Island First Nations communities, whether we're on or off reserve. So we have 7 First Nations communities and then we could do some kind of satellite office work also if there's people who live in some of the surrounding areas that aren't on reserve. But over the years, I really noticed how there was a disconnect between clients' diagnosis, um, and their level of understanding of what that meant and what was really going on in their body. And then to kind of make things, I guess you can say, worse, is their primary care provider would prescribe something and they didn't necessarily understand the benefits of taking a Western medication and how that could help, and that not depending on our lifestyle factors, how doses could change. Some people needing more medication, different medication, some people having things improving and decreasing. But they really were, there's a bit of a gap between those two things that we were hoping to improve health with. So as I was doing diabetes teaching in the community, I started to notice that there was still some disconnect. So we could go through the health teaching portion about what's going on in the body. People could really understand what was happening and they knew their medications. They knew all the things. They could recite it back to me. They like truly understood, but it was still, there's something still getting in the way. And as we get into it, a lot of it had to do with our mental health and dealing with stress. So the purpose of today is for me to try to bridge the gap between our mental health and stress and how we get from A to Z, Z being chronic health. So things like diabetes, chronic pain, high blood pressure, increased cholesterol, um, different health, um, chronic health that we see in the community fairly often. So I really want to just try and see how I want you to understand how we get from that stress and how we end up with things like the high rates of diabetes that we have. Because it's Diabetes Awareness Month, I will use a lot of diabetes for examples. But if anyone's on and wants to share, would like a different um, example, I'm happy to explain it in a different way. So this is one of the pictures I really like because it's simple and regardless of your age, you can teach this also to kids. Um, but our brain is the piece of us that makes decisions. It's what's going to cue how our body responds to situations. Um, so if everyone has their hand, you can see the different pieces. So our wrist kind of being the spinal cord, brainstem, um, the hippocampus and the amygdala. And then as our hand closes, if you look at the shape of our head, it would be kind of something like this. So our forehead is going to be where our prefrontal cortex is. The back of our head is going to be our amygdala. And the other thing I like to say, and I think it's on the next page, but it's called I think it's on my next slide. Yes. So it's called flipping your lid. So if we look at our brain and we get too too much emotion and we aren't able um, to cope with that, and that is essentially I think that's probably why I like it so much. It's fun. But yeah, so we're flipping our lid. And what we're doing at that point is we're not using that front part of our brain, that one that's going to be that rational thinking. Um, so this is you know, this is Dan Siegel. So when I was doing my CBT and then a lot of psychology courses and things, you'll learn different ways to understand the brain. And this was one that I really liked because it just makes sense. So that amygdala, that kind of hind part of our brain, that's our reptile brain. And that is, like it says, it's our survival brain. So that's like the very basic needs, and it's going to get activated when we have a stressful situation or something is being perceived as a threat to us. Then we move into our midbrain. You can see the monkey because we kind of refer to it as a mammal brain. And that has to do with a lot of emotions, memory, um, and that's where we hold on to a lot of our trauma and intergenerational wounds. And then we go to the front of our brain, and that is that prefrontal cortex. Um, that's like our human part of our brain. And we are able to do rational decision making with that part of our brain. But the thing is that when we are under stress, we don't necessarily have access to that front part of our brain. So we are making a lot of our decisions based on that reptile part of our brain and some emotional responses. Why we can all make very irrational decisions when we are in a stressful situation. The endocrine system. So within the brain, there are some key, sorry, I'm wearing headphones and my ears are getting a little disgruntled. There's some key hormones that we're going to see as we go through the information. Um, but it all has to do with stress. So if we go back to our brain, um, when we're in a stressful situation, there's going to be a cycle of events that happens, and our endocrine system affects so many different parts of our body, as you can see on the left. So we've got our thyroid in there, we've got our pancreas, we've got our sex hormones, and it's really just like a cascade. So it starts with one activating another, and then it just kind of follows. And as that path follows, you can see a chain of events as to how different parts of our bodies can be affected by things like stress. It's a little easier to understand on the next slide. Here we go. So this cycle is called, it's called the stress cycle. But the main players in it is the hypothalamus, the pituitary, and our adrenal glands. So when we have a stressful situation, regardless of what that stress is, whether it's home, work, family, um, financial, physical, our intergenerational traumas that we have. It could be something very short and situational. And then also, we can have positive stress too. So we have that positive stress when you um, get some good news. Um, maybe you're starting a new job, different things are going on. Maybe your kid wins their scores their first goal at hockey. Those are things that are going to cause positive stress. And what happens, regardless of the type of stress that we are um, interpreting, is you can see at the top, I have stressor, and right beside it, I have a picture, because our nervous system is going to it's going to become aware of something that is a stress, whether that's good or bad. And then within our brain, the hypothalamus is going to signal a cascade of events. So there's the CRF hormone that was present on the page before. It's noticing that there's a threat to us, which is then going to signal the pituitary down to the adrenal gland, and then I'm going to kind of move along a bit quicker to get to cortisol. So cortisol is our stress hormone, and it's really what is causing, or I guess activating, the next series of events. So cortisol um, is going to trigger our body to release adrenaline. So epinephrine is the medical name, but I'm happy if people can remember that cortisol is a stress hormone and epinephrine is adrenaline. So what happens is, say we have, I'm just trying to think of a stressful situation. So we're getting chased by a bear. What's going to happen is the sequence of events, and I just have a little bit of an image at the bottom to represent the system. So our blood pressure is going to increase. We are going to have increased respirations, because what's happening is our heart's beating faster, trying to get more oxygen to our brain. Our heart rate is going to increase, and how that increases is our blood vessels are going to constrict. We are going to we're going to become more aware. We're going to hyperfixate. To run away from a bear, we have a process in the liver that is going to take any adipose tissue, so our fat cells in and around that kind of midsection that we have, and it's going to convert those fat cells back into um, sugar that our body can use for energy. So it's going to turn it back into glucose. And that energy is going to give us that speed and that endurance to help us run away from the bear. Also, our digestion is going to decrease, because that isn't necessarily going to help us at the time of need, when we're trying to run away from a bear, that we need to do things like go to the washroom. And our body is really just trying to help us survive at this point. So this whole HPA axis is really what I like people to know is going on. So our body interprets the stress, our brain signals a series of hormones, cortisol being the stress hormone, epinephrine being adrenaline, and then these series of events are going to follow. So what the issue is when these are ongoing, um, it's a little hard, because in clinic, when I'm going over this, I do like to show pictures kind of all at once and have them kind of going back and forth between, so you can see that big picture. It's a little harder to do it in a presentation, because it's showing as being very linear. Um, but when you have that stressful situation, we have a window of tolerance, and in the middle is going to be where you want to be. So, or where our body is most grounded, where things are good. We're able to fluctuate with certain life stressors. things that are exciting, maybe things that are negative, and it's going to be able to keep us there. And it's when we get out of that ideal arousal zone that we start to have things perceived as um, it's a threat or as a stressor. So I've heard it described before as often thinking ahead too far and worrying is going to present as anxiety and stress. And then thinking about the past is going to cause us to feel more depressed, but withdrawn, or we're going to disconnect. Um, and then where we would want to be is in that middle, where we're present, where we're mindful, and we're able to kind of function with the highs and lows. One way I've explained this to people is if you can think of a glass of water and if you fill it half full or if it's half empty, however you see things, but we'll be optimistic, so half full. And depending on how your day is going, everyone's going to have a different base level of water there. So mine might be slightly fuller, it might be slightly emptier than the next person's, and we're all going to have that baseline. So as we're going through our day, through the years, through life, that baseline is going to fluctuate. And depending on different types of stressors, positive and negative, and how we're able to cope with them, we're going to have more or less water in our cup. So, something we have too many things on our plate. Like I mentioned before, I've got work, I've got school, I've got kids, I've got animals to be fed. So my cup's filling up because I've got a lot of things on my plate. With it filling up, it's going to get to a point if I'm not taking care of me that if I just keep adding to that cup, it's going to eventually overfill. And then on the other hand, I can do or implement positive coping strategies if I understand what's going on, and I can help to self-regulate. So if my cup is feeling a little too full, I can do things that are going to help to decrease that baseline. And then as that baseline decreases, that's going to give us that much more room, just as in the picture here for that optimal arousal zone. Where you're still able to think with the front part of your head, we're still rationally thinking. So what we're wanting to do is kind of optimize how much room we have to flex in that area. We don't want to have so much and be so overwhelmed that our cup is then going to spill. And we're going to want to do positive things that are going to help to widen that window of tolerance. I don't know if anyone has any questions or how many, I'm not actually sure how many people are online, but if anyone has any questions on that, reach out or.
No, we haven't had any
So-
questions that have come through yet.
Okay, awesome. Well, not awesome, but thank you. I'm not missing anything. Looking at that window of tolerance, if you look at the two pictures, I'm just going to gonna flip back and forth for a moment. So it has that optimal zone. And also when we look at blood sugar regulation, we also have an optimal zone. So when our blood sugar is spiking, it's very similar to our window of tolerance. And then at the same time, it's also going to crash. But the thing to notice is whether our sugar is high and we're overstimulated, or whether it's crashing, that is causing stress to the body. So again, it's going to stimulate that stress cycle, that cascade of events. If anyone has a CGM, a Dexcom, or a Freestyle Libre, or if they track their blood sugars with pen and paper, this is really cool to see because you can actually see the different pieces of your day. And once you have that self-awareness and you realize kind of what you are paying attention to, you can start to notice how it affects your mood, or maybe when you are feeling a little more fatigued and when you're a little bit more excited. So there's some really awesome connections you can make if you know what you're looking for and how to relate those to each other. So before, I mentioned that the whole reason why I wanted to talk about this is because there's a gap with how people interpret chronic health and the stress that's that underlying factor in whether it's the root cause, or if it is something that may be making things worse, exacerbating it a little bit. If that HPA stress cycle is constantly being activated, that's going to set our body into that series of physiologic events. So the increased heart rate, the increased blood pressure, the liver increasing our blood sugars. And if you think of that stress on the body, if that's going on day after day, year after year, kind of generation after generation, you can see how we have ended up being people who have been targeted at having higher rates of diabetes, higher levels of negative chronic health outcomes. And it isn't necessarily related to poor decision making. Sure, some of us, myself included, don't always make the best or the smartest decisions all the time throughout my whole life. Um, but those are not the reason why things are happening. If we look at our history and that intergenerational trauma, all of the things that are all of our ancestors, all of our family, all of our communities, our nations, all of the things we've always gone through, it's a series of systemic stress. Some pieces improving, some not, some just are too, they're taking so long to change. But that chronic stress is going to have a negative effect on our body and how we adapt to stress. So if we constantly are in a state of stress, whether that is acute or chronic, so acute being something maybe like a broken bone or getting chased by a bear or getting locked in a room with no food, something fairly short term, hopefully. But then when that stress system is activated for a very long period of time, that's when we're going to start to see things like increased inflammation. And when we have high inflammation, or if we have a wound that our body is constantly trying to heal because it's got damage to the tissue, from increased blood pressure on the inside, our body healing itself also requires energy. So that's a source of stress. And again, that's going to require all of those things: increased circulation of our blood so that it can bring our white blood cells. So, and that cascade is going to need energy. So it's going to need to make sure that we have enough sugar in our blood to keep going. It's going to want to make sure our cells have oxygen. But if this is just constantly going all the time, you can see how we end up with things like diabetes, heart disease, uh, disrupted sleep. Um, for diabetes specifically, like insulin resistance. Um, and then again, once those things are disrupted, there's also a series of events that are going to happen if we aren't making changes and if we don't understand that normal functioning of our body. It's really hard to understand what isn't working or what we need to focus our attention on. So I don't want to spend all of the time just kind of going over like the negative pieces, but I wanted to make sure that people understood that correlation between stress and how we end up with these chronic health issues. When we get into health versus healing, this is one thing that I really struggle with, being First Nations and working in a um, mostly Western monopolized healthcare system, is the difference between health and healing. A lot of the times, we can get caught up in the health of people, and that being, um, I guess, being compared to this normal standard, what it should be. And it's hard because what they are measuring us against isn't necessarily what how we see things or what we may see important in the moment, or um, we just have sometimes we just have a different value system that isn't captured with numbers. So our worth as people, as community members, um, that isn't going to be captured by whether or not our blood sugar is high or low. It's not a moral measurement. It's not going to measure our relationships with each other, how we're treating each other, how we're treating ourselves, our families, our kids. So a lot of health is focused on those labels, um, having a diagnosis and what that means. But when we get into healing and look at it more holistically, that big picture, that's when we look where we can go back to what's going on and how are we interpreting the situation? How are we able to cope with the situation? We understand that stress series of events and the different things going on in our body. And then once we know that, we can understand how we can make changes. And one of the ways that I love to incorporate is the different arts and crafts that our people have always done and used to always be part of our day. So when we talk about filling that cup, these are things that are going to help to lower how full our cup is, when things are getting busy and stressful, we're able to use those teachings, that knowledge from our elders, and we're able to calm our nervous system and our brain so that not everything is being interpreted as, we don't just constantly have these little fires that our stress hormones are trying to put out. We can actually take the time to go from that back reptile part of that hindbrain piece that's very survival um, focused. It's going to be like our fight or flight response, and then we're able to use the frontal part of our brain and make those decisions that maybe require a bit more thought, a bit more logic behind making a decision. Um, so our cultural practices help to activate the parasympathetic nervous system, rest, heal, digest, and help widen our window of tolerance. So that's decreasing that baseline amount of stress that we have, and it's going to widen what we can tolerate. I love this little piece of writing. So this is from my oldest son when he was in grade 5. Every year they always come home with all their stuff from school at the end of the year, and I'm always sorting through it, trying to figure out what I want to keep, what I don't want to keep. I can't keep every little doodle that they do, but this, I had no idea this was done, and I got this at the end of the year, so it would have been the very end of June. Um, Knowing me, it probably sat in a pile for a month later. So it was probably middle of the summer. And this was just written on like kind of a loose sheet of paper. And I think the date was, yeah, it would have been within the first couple weeks of school. So he was 10 at the time, he's 12 now. I will read it out just because it's my favorite. So my favorite subject is art because it's calm, time consuming, and it can be anything you want. In art, it is very calm and it's time consuming, and the drawing is the most calming part. It's amazing because you could draw anything, a bear or a fish. When you do art, there are a bunch of colors involved. So best you draw with pencil crayons. Some of the colors are blue, cayenne, and green. I hope when I get older I can draw like famous people so I can make my drawings look realistic. And this was like when you have those like warm and fuzzy feelings. I was so proud because we do a lot of art things at home. I really try to just have materials available so that my kids can, if their nervous systems are going a little wild, they can take the time and they can draw or color and do what they need to do to help calm that nervous system. So when he wrote this at the beginning of the year and I didn't find it till almost the next year later, I was really happy because it's stuck. I never know if what I'm saying, if anyone's listening to me at home. Most of the time it feels like they are not. Um, and I really try to strengthen this. This is one of his strengths, and same for my younger two boys. Um, One of the things I encourage them to do is when they're feeling a little too, um, when they're having their meltdowns, really emphasizing that they're thinking with that reptile survival part of their brain, and trying to get them back into that logical part where I can talk to them. Because if someone is having a meltdown, whether they're mad or sad or they're just too excited, they're not going to hear or understand completely because they aren't in necessarily the right part of their brain to have that higher level thinking to put the pieces together. So to decrease that stimulation, I always try to encourage them to do this, and that's one of the reasons why I like doing this talk, because it is so important. So I don't want to, well, I have art therapy, but I meant it more in like a therapeutic benefit. So we have beading, we have sewing, picking the colors for ribbon skirts, our quill work, um, depending on what area in Ontario or Canada, depending on where you're tuning in from, your family, your community, your nation, you're going to have those things that you've done. When we are doing these therapeutic art activities, crafting, um, our body, we become more mindful. So we're noticing the texture, the color, the patterns, um, even something like I go to the store and I'm trying to pick a pad of paper for school, and I'm always touching everything, and my husband's like, "What are you doing? And why are you like petting the paper?" And I'm like, "Because it's gonna bug me if it's super rough. It's gonna like my pen's not gonna write on it, and it's gonna get blotchy, and it's gonna irritate. It's gonna agitate me." So we become more aware of those little things. When you are maybe picking ribbon for a ribbon skirt, there's satins, there's matte colors. um, we become aware of what's complementary, what we like. um, when you're working with different leathers, you can tell by touching the leather if it's deer hide, if it's moose hide, if it's bison, it's going to be so thick. And you're in tune with what you're doing. So you are not thinking about all of the other things. You're not thinking about all of your bills you need to pay. You're not thinking about all of your tasks. But when you take your time and you work with whatever your, I guess whatever you prefer. So whether that's painting or sewing or beading, um, you're going to be aware and in tune. And that's what's going to really help to decrease that nervous system stimulation. That's really going to help to widen that window of tolerance. The other thing is, sorry, I need to take a sip of my tea. One of the ones that I struggle with myself is that perfectionism. And I think a lot of people have this because a lot of us were growing up, there was a right and a wrong way to do something. There was a product that was either a good product or a bad product. Something was right, something was wrong. Um, and the whole purpose when we are working with our hands, when we are making art, whatever that art means is to us, is it's not about making a perfect product for someone. Sometimes that mindfulness piece is it's the process in doing it. So we aren't trying to make we are not trying to paint a picture of a tree and a scene that is going to look perfect to somebody else. It's really just paying attention to colors and how the different paint textures go together, and really being in tune with what you're making and not doing it for someone else, just doing it for yourself for the sake of doing it. And a lot of the times too, I will often tell people, like, depending on your mood when you are painting, maybe you paint a picture and you're in a very good mood. You might want to save it because it's a reflection of how well you're feeling. However, sometimes you just want to scribble on a page and get that like anger and frustration out. And you don't necessarily want to keep it because you're trying to release something, that emotion. And sometimes it's just cathartic. Like I will bead or I'll paint and I'm like, I don't even like this. Like it looks ugly. Like I'm judging my own art, but based off of what? And once I can remind myself of that, often I'll rip it up or I'll chuck it in the window if it's winter. Um, but I get rid of it and it's like a cathartic, like it's a release. So you can get rid of that um stress, that tension, but it does feel very nice because you can feel that calmness you had while working on it and remind yourself of the benefit that you weren't doing this. Doesn't need to be for anyone but yourself. So I'm going to end with a short little activity that people can do at home. And it is not meant to be a picture by any means. It is not meant to be, it's, you're not trying to make a product. It is the process that we're working on. So, what you want to do, and this is just an example of one that was completed that I found on the internet, um, but you want to draw lines on your page. How you draw them is up to you. I didn't want to give visual instructions because it's how you are interpreting the instructions. So you can make wavy lines, you can just kind of make straight lines back and forth. Um, and then if you have a glass or something circular around you, if you have a mason jar hanging out, something like that, trace a few of the circles over the page, or you can just hand bone the circles. They do not need to be perfect circles. Just get some of them on there. And what we're wanting to do is where you have the intersecting of the lines, you just want to smooth those out. How in the picture you can see the boulder pieces and you're getting off the edges, and you can just pencil, pen. If you have markers, you can follow it. Um, Sometimes I'll use watercolor, and where the colors kind of meet up and dry and you can see that line where it's dried, I'll trace those out. But every time you see a sharp edge, you want to smooth it out and just kind of focus on going around, smoothing out all of those corners. You can go back and add color if you want. Um, if you look it up on Google or if you use Pinterest, I'm sure YouTube and TikTok have examples. I know TikTok does and Pinterest. Um, Neurographic art. And I really like this because it's something that we can do anytime, anywhere. It's great to have access to paint, pencil crayons, whatever you have in your house, whatever your kids have, but also realizing that not everyone has those. So just being able to do something so simplistic that has such a good benefit um, in helping us calm our nervous system and widen that window of tolerance for stress, which is going to help us to decrease the amount or the frequency or the extent maybe of that stress cycle being activated. I also like to have it in my planner for work. So if I'm sitting in a meeting or something that I'm required to sit still, because if anyone is like me and has a hard time sitting still, or they start fidgeting, I don't know if anyone noticed me. I was kind of starting to go back and forth on my chair to remind myself I was doing a presentation. Don't do that. Um, but doing this type of a mindfulness activity, or if you're in school, things like a lecture that can be kind of dry and you find yourself your thoughts going elsewhere, it's a really nice way to still be able to listen to what's going on, but to be able to focus, because what you're doing isn't requiring thought, like it's not requiring, I don't want to say thoughts, calculations. So you can still look and have your that need to kind of move around and be busy. It's going to help to release some of that tension when you're kind of stuck being somewhere that you have to stay in one place or stay still. So I like to add that as a little bit of a tip um for at work or school situations. Yes, that is it. I'm not sure how long I chatted for because I'm used to having people that are on and gabbing and asking questions. This seems like the quietest presentation ever. But if anyone has any questions, that's my work email. I put Noja's website up there, but miigwech to the Ontario Native Women's Association for inviting me. It's really great. I really hope this helped to bridge a bit of a gap between when you're at the doctors or nurse practitioners and they say your stress will increase your blood sugars or being sick will increase your blood sugars, um, or why we focus on mental health so much, because they're really just trying to improve that nervous system overstimulation and widen that window of tolerance so that we can be less in survival mode and thinking a bit more logically, at least most of the time. Um, yeah, so I'm gonna stop sharing now. I don't know.
Hey
If there's
Kendra,
anything
thank you
else.
so much. I have a quick question. We don't have too many questions. We didn't have any questions that were coming in through the chats, like during your presentation. But I imagine that later on, overnight over the next few days, we might get some posted questions. So we may be reaching out to you just for a little bit of support with answering any questions from our community members. I have a question though for you, and I was just wondering, I didn't quite hear what you said, like the name of this type of activity. Do you have a name for it? Are you able to see?
If you're looking up for like similar or different ways, it's neurographic art.
Neurographic. Okay, cool.
Yeah.
It is really nice just to sort of let the pen move across the page, and I found that it almost made me hear your words of your presentation more clearly just while I was looking away, and almost like my attention was still like focused on this. It actually made it a little bit easier to to hear you and to hold on to that information. Thank you so much for introducing me to that.
Yeah, definitely.
Yeah. Do you have any questions, Sam?
No, that was a great presentation, and yeah, just a good explanation about the importance of, knowing the stress in your life and the effect that it can have on your body.
I really liked also how you emphasized that, like there is so much against us that I think you had said, we all have those moments where we may not make the greatest choice in that when we're sitting down for that one meal or that one snack. but it's not these things that are contributing to our health. I think that message is really important to get out there and to repeat, and so that we can really spread that message out to everybody. Sometimes we're at different places too for a readiness to hear some information or to take some information in. And I really appreciate you saying that.
Definitely.
Sometimes it's great to just repeat those like basics. And I also really liked how you went over just that, those fight or flight responses and the cortisol versus the epinephrine, because there is still that, it might seem really like an older idea. And I always think about the bear too, when I'm like, I meet a bear on a trail, like this is what's happening. But there's so many things that we encounter in our day that our body thinks we're seeing a bear, and that we're in that bear, running from that bear again. But it might not, it might not seem as intense or as severe as that, but our reaction is still so similar.
For sure.
Mm-hmm. Thank you so much. Yep. Samara is going to go over, she has a few things going on this month. Thank you again so much for joining in and sharing your knowledge with us. We really appreciate this.
Mm-hmm.
Definitely.
Thank you.
Okay. Bama.
Bama Pete.
Bye. So thank you for tuning in to today's Indigenous Women's Health Talk. Just a few things we have going on for the month of November. We have Move Your Body Wednesdays. And so coming up Wednesday, November 12th, we have Métis jigging. And
that'll be a good one.
It's really fun. If you have a scarf, please bring that to I guess your computer, because it'll be online. If not, you can use a towel or a cloth. And if not, that's okay too. And then November 19th, we have chair yoga. And so that'll be, you'll be in your chair, but there'll be some standing too. So it can be either or. And so those are the two we have coming up for the month of November.
Chair yoga is great. And what's the time that these are happening?
Oh, and sorry, those are noon to 1, I guess Eastern Standard Time.
Perfect.
In Ontario.
And so those are posted on the website. They're on our Facebook page for sure, I saw today. And the registration links are within those posts. Mm-hmm. Okay. So that survey is definitely going to be posted again at this moment. So I just want to take this time to invite anybody who has a few minutes to just offer to let us know what they thought about the presentation today, and if they liked something like this and hearing this type of information, if there's any other ideas you have about future women's health talk topics, we really would love to hear those from you. And as a reminder again to those might be joining now and missed the beginning, I do like to offer out, we have a draw gift for all the surveys that we receive. If you would like it to be anonymous, then do not leave your email. But if you'd like your name to be put into the draw for a gift for providing us with some survey feedback, we'll put your name in for that draw. Thank you so much, everybody. Take care. Have a great day.
Bye.
Bama P.